Hello, and welcome to NewPod. A slight swelling may seem harmless at first, then become worrying when it persists or changes. This episode follows that path from the first noticeable change to a full assessment to explain secondary lymphedema and clarify the proper role of manual lymphatic drainage. At first, the change may be almost impossible to notice. A sleeve feels a little tighter, a shoe leaves an unusual mark, or a limb feels heavier at the end of the day. The person watches, waits, and compares it with the other side. They may hope everything will return to normal on its own, even as concern begins to grow. After surgery, cancer treatment, an injury, or an infection, this detail can take on special meaning. Without presenting this as a real testimonial, it illustrates a common path. A subtle symptom gradually becomes a reason to seek care. The starting point is not a massage method, but a physical change that deserves an explanation. This is general information. It does not provide a diagnosis, replace medical advice, or teach anyone to perform a therapeutic technique alone. The period between waiting and seeking care matters. Swelling is not automatically lymphedema, and simply calling it water retention can hide the wide range of possible causes. The goal is to describe what is happening without reaching a conclusion too quickly: when it began, which area is affected, how it has changed, whether there is tightness or heaviness, and what happened beforehand. These details guide a professional assessment. They also move the discussion away from vague claims about supposed toxins. Lymphedema is a specific condition linked to reduced function of the lymphatic system. Before using that term, a professional needs to examine the whole picture. A consultation does not make the symptom more dramatic. It provides a clear framework for finding its cause and, when needed, choosing appropriate care. To understand the process, picture a transport network. Lymphatic vessels collect and carry a fluid called lymph. When this network is damaged or its capacity is exceeded, transport becomes inadequate in the affected area. Fluid may then build up in the tissues. This physiological mechanism can contribute to lymphedema. The term specifically describes an accumulation caused by insufficient lymphatic function, not every possible kind of swelling. The mechanism explains what can happen in the body, but it cannot identify the cause in a particular person. That distinction is essential. Understanding lymphatic circulation offers a general reference point, while recognizing lymphedema in a real situation requires a clinical diagnosis. That diagnosis considers the signs that are present, how they developed over time, and the person's medical history and current context. Secondary lymphedema develops after damage to the lymphatic network. Cancer treatment is one possible setting, but it does not define the whole subject and is not limited to breast cancer. An injury may damage lymphatic vessels. An infection may affect them as well. Other forms of damage can reduce the network's transport capacity. In every case, the word secondary means that an event or condition came before the lymphatic impairment. Onset is not always immediate or dramatic. It may be gradual, with small changes becoming clearer over time. This variety rules out shortcuts. A possible cause is not a confirmed cause, and medical history alone cannot establish a diagnosis. A professional connects the medical history, clinical examination, and progression of the symptom before offering an interpretation. For levels must remain clearly separate. First, the physiological mechanism describes how the network works and how fluid may accumulate when transport is insufficient. Next, a clinical diagnosis determines what actually explains one person's swelling. Then comes the treatment option, selected according to that diagnosis, the goals, and the context. Finally, some uncertainty remains because progress and response to care vary with every situation. Mixing up these levels can turn a possibility into a certainty or present one method as a universal solution. Separating them helps keep expectations realistic. Established facts provide a framework, but they do not replace an individual assessment. This caution does not mean waiting without taking action. Early care may help, provided it begins with correctly identifying the problem. The idea of early care needs to be expressed carefully. It promises neither a cure nor the same outcome for everyone. It means that a symptom noticed and assessed without delay may lead sooner to advice, monitoring, or suitable care. The intended benefit should be concrete and tracked over time. Depending on the situation, this may involve monitoring swelling, discomfort, or functional ability. follow-up shows whether the chosen approach is still useful. It also prevents treatment from continuing simply out of habit. Spectacular commercial results, guaranteed transformations, and one-size-fits-all explanations do not reflect clinical reality. A sound approach states its goals, limits, and reassessment criteria. It also accepts that an option may need to change when the expected effects do not occur. Manual lymphatic drainage may have a place in this process, but that place depends on the diagnosis and a professional assessment. For lymphedema, it is generally considered one possible part of broader care. That care may include compression, suitable movement, skin care, and education to help the person understand and monitor the condition. None of these elements should be separated from its context. Compression, movement, and skin care are adjusted to the person, the affected area, and their health. Drainage is not a standard ritual performed the same way for everyone. It is one treatment option among others, used with a defined goal. The professional should be able to explain why it is suggested, what improvement is being sought, and how its usefulness will be evaluated. The limits of manual drainage must be stated without ambiguity. When used alone, it has not shown a consistent effect on lymphedema volume. It is also not recommended as a routine preventive measure after breast cancer. These findings do not rule out every use, but they prevent drainage from becoming an automatic response. They call for attention to the individual situation and the entire care plan. Drainage alone does not cure impaired lymphatic function. It does not remove body fat or detoxify the body. No lasting result can be guaranteed. An honest explanation separates possible comfort, the intended clinical goal, and the effects actually observed. This distinction protects people from unrealistic expectations and supports a clearer conversation between wellness services and medical care. Safety comes before any massage. A red, hot, painful area, especially with a fever, means massage should stop and appropriate medical help should be sought quickly. The same is true for sudden swelling or swelling on only one side. Chest pain, faintness, or unusual shortness of breath also requires a rapid response. These signs cannot support a diagnosis from a distance, but they show that medical assessment should not be delayed. The right response is not to manipulate the area more or try a method found online. Stop the technique and have the cause investigated. Even when lymphedema is already known, an unusual change deserves specific attention. A new symptom should not automatically be blamed on the existing condition. This distinction keeps the next step grounded in the person's actual situation and in a professional assessment. Even when there is no emergency, diagnosis must come before technique. Contraindications and precautions vary with the person's health, the area treated, and the overall context. A postoperative period is not managed like a stable condition. Cancer care also requires suitable coordination. That is why detailed drainage instructions do not belong here. Repeating a therapeutic maneuver without an assessment could overlook a risk or pursue the wrong goal. Caution does not mean placing medicine and wellness in opposition. It means honestly defining what each intervention can offer. Comfort care and lymphedema-focused treatment do not necessarily meet the same need. The professional's qualifications, knowledge of the context, and ability to refer someone for medical advice are useful checkpoints before any intervention. Before an appointment, a few simple notes can make the conversation more precise. Record when the symptom began, how it has changed, and when it becomes more visible or uncomfortable. Prepare a list of medical history, current treatments, and previous procedures. This information is not for making a diagnosis alone. It gives the professional a timeline and context. It also helps to mention what has already been tried and what effects were actually noticed. A general impression can then become a more structured observation. This preparation makes it easier to distinguish a recent change, gradual progression, and a stable situation. It can also keep an important detail from being forgotten during the consultation, when concern or the amount of information makes conversation harder. During the conversation, several points deserve a clear answer. First is the exact diagnosis being considered. Second is the measurable goal of the proposed care. Third is how and when its usefulness will be reassessed. The professional's qualifications should also be verifiable, especially after surgery, during cancer care, or when lymphedema is involved. Asking for these details does not undermine trust. It helps build a decision that is understandable and appropriate. A treatment may make sense for a period and later need adjustment. It should not continue only because it was started. Prepared questions can cover the expected result, other parts of the care plan, personal precautions, and signs that would justify another medical assessment. This distinction keeps the next step grounded in the person's actual situation and in a professional assessment. This episode follows one simple idea: lymphatic drainage is a possible tool, but its value depends on the correct diagnosis, realistic goals, and suitable care. The experience of swelling deserves to be heard without immediately forcing it into a label. The lymphatic mechanism helps explain the body, while a clinical examination determines what is happening in one specific situation. When drainage is considered, it may sit alongside compression, adapted movement, skin care, and education. Its effects should be observed, its limits acknowledged, and its continuation reassessed. If a warning sign appears, massage stops and medical advice becomes the priority. Moving from observation to assessment and then to a treatment choice allows progress without creating panic or accepting exaggerated promises. This distinction keeps the next step grounded in the person's actual situation and in a professional assessment. For now, the most useful action is to keep a clear record of the symptom, gather the relevant medical information, and prepare points to discuss with a doctor or physical therapist. The diagnosis, care objective, practitioner's qualifications, and reassessment criteria form a solid foundation. This approach makes the person an active participant without placing responsibility for diagnosis or treatment on them. It also helps separate general information from personalized advice. The next episode, about the stages of lymphedema, will continue this path with new reference points for understanding how the condition can progress. Until then, any new, persistent, or concerning change deserves appropriate advice, and any warning sign calls for prompt medical help. This distinction keeps the next step grounded in the person's actual situation and in a professional assessment. Coming soon, listen to The Stages of Lymphedema to continue this journey with clear guidance. The medical sources used to frame this episode are listed in its description.